Hi, I'm Sarah Sullivan, one of your instructors for patient education as a strategy for advocacy. And I just wanted to make an introductory video to welcome everyone to the course, as well as to tell you a little bit about myself, my reason for developing this course, and also what I'm hoping you will get out of the course of the next 2 weeks. I won't spend time going through the entire syllabus. You guys can obviously read that on your own. Um, One thing that I do want to talk a little bit about was really the reason that I thought about coming up with this course and um, what what I hope you guys will be able to do in the next couple of weeks regarding reflecting on yourself as a physician and your interactions with patients. My background is actually in educational psychology. My PhD is from here, the University of Wisconsin in Madison, in educational psychology with a focus in learning sciences. So, what that means is I study and spend time thinking about and trying to improve learning in a variety of different contexts. So, I used to teach a course on human abilities and learning, which is an introductory course here at UW, which deals with learning theories and different ways that people learn. So, one thing that I realized was that many of the pre med students in my course um, really weren't thinking about their patients as learners. They'd talk to me about their projects and say, well, I don't really know what to focus on for this project. I'm not working with students. And so we would talk about the fact that, well, really, you work with students or learners every day. You're working with your patients, and you need to think about how you're going to educate them about um, their health issues, treatment plans, um, suggestions for lifestyle changes. There's a variety of different things. And so when I got here to surgery, I've been here for about the past 3 years. Um, I really wanted to be able to develop a course for medical students that gave them a chance to reflect on themselves as teachers of their patients and also reflecting on how people learn, and particularly how adults may learn, and also issues um, that may impact patients' abilities to learn or to follow the guidelines that their physician would suggest. So we'll also be talking a little bit about advocacy and patient education as advocacy, um, because one way in which we can be, and you all as physicians can be advocates for your patients and for their best interest, is making sure that they are able to be as fully informed as possible with regard to their conditions and treatments and so forth. And so I'll also have you do a little bit of thinking about yourself as an advocate, um, and how that relates to how you interact with, communicate, and educate your patients. Uh, this is a surgery course, but the things that we're learning here are as you've probably guessed, really not surgery specific. You'll spend some time um, in clinic. So the goal is really that you'll be able to think about some of the conceptual material that we're learning and discussing, and then apply that to um, your interactions with patients. So first, you'll spend some time in clinic or in another setting in surgery in which people are communicating with patients, thinking about and observing the different strategies that people use. You use that to kind of reflect on your own interactions with patients, and then going back into the clinic and actually having some interactions with patients and thinking about how your communication with them is going. And that will really be um, the basis of a final paper you'll do for the course, which is really asking you to combine both some of the theoretical things and research-based things that we're discussing, as well as your own practical experience working with patients during this time. So for this first week, what I really would like you to focus on and reflect on is both the concept of advocacy and what that means to you as a physician. And you'll do some reading and watch a video related to that. And then also issues with patient compliance, and that's related to the first chapter in your textbook that you'll read. And really trying to think about some of the issues around compliance, the different kinds of non-compliance that patients may exhibit, and what some reasons for that may be. So in the next few days, we'll start talking more about learning theory and thinking about how might we approach patients in general, knowing how adults and people learn, and then throughout the course we'll start to build in thinking about patients depending on their circumstances. So issues related to age, culture, language barriers, or other communication issues. And so really trying to tie it all together to help you reflect upon how you may want to approach communication situations with your patients as you move forward in your career as a physician. So welcome to the course. Excited to have you, and we'll be meeting in person to discuss your projects and a few other logistical things related to clinic, etc. But for now, you can work on day one materials, take a look at the syllabus, and looking forward to having you in the course.